Okay, so I'm convinced that UAB also patient dummy, and I've got my wristband up here. The only thing I got from the UAB visit, and this was in June of 2019, was to go and see my other videos that I did on my UAB visit. UAB was reported to have 1,157 beds in its hospital. That's as of 2020. 1,500 physicians, 17,642 employees, 92,000 discharges annually. And, you look around on the internet on these estimates, UAB is it's one of the largest hospitals in the United States. And, a few years ago, I think it was ranked 20th or so. They do things a lot differently than the other hospitals that I've been to. And, the waiting area, it's small, it's cramped. And I think that I've realized that they're using this triage system up, the list backed up for hours and hours and hours. They're using this method to circumvent obeying this EMTALA law. So what they do is, you go into the emergency department, and this happened to me. They had a broken skull, possibly leaking CSF fluid. And at this point in summer 2019, I was dying. My symptoms, I was becoming chronic with the infection, and I found out an infestation of parasite worms in this wound underneath my skull that was broken. Okay, so I went into this emergency department. I brought in CD. I brought in printed out images, CT images, MRI, X-ray. I had my records scanned in, printed out. I brought in all this stuff, full of people. And, like I said, some people I saw, they had been waiting there 10 hours in a triage list. So they're waiting people out. The patients that were taken in order of their importance in this triage list were not necessarily the ones that you might think. They had a lot of withdrawal and drug addicts that kept going back. So I went up to the front desk. They do this triage screening, and they put me in the computer and give me a wristband, zebra wristband. I told them I thought my skull was broken. I told them my neck felt like it was broken. Described all these symptoms. At this point I started having these nightly parasite attacks. And in the evenings I lay down and my heart would start beating fast. Body temperature was out of whack. I checked my temperature. I didn't always have a fever, but my skin felt like it was red hot. Okay, they triaged me. Okay, based on my symptoms that I expressed. And there was no seating there to speak of, so I stood for 5 hours in this place. Nobody ever saw me. I was never called to the back. My triage number never came up, so I was not able to see a doctor. They wait out the patients. They wait them out, and they use time. They're going to see who can hold their breath the longest, basically. What this reminds me of, and this is a scam that nightclubs in big American cities used to pull. So, on the weekends, you're riding around nighttime, downtown, the entertainment areas of these big cities, and you see the nightclubs. And then out in front of the discos and nightclubs, they'll have these long lines that wrap around the block. Okay, so you see one of these things, and you're like, wow, that must be a pretty happening place. So you park in the parking lot, and you queue up, all right? And you may be waiting in this line for hours, right, just to get into this nightclub you think is going to be and hype. But and what happens is the bouncer, the doorman, he'll go through the line, and usually this is to flirt with girls or something, and they'll pull girls out of the line and move them up to the front, let them in to this club. So anyways, hours later, when you finally get into this nightclub, you realize it's totally empty. There's nobody there. And what they did was the system that they're running, as soon as people like enter this place, most of the time they just walk out the back. And if you're in line in front of this place, you don't ever see them leave. This is like totally unacceptable. I read these numbers at the beginning of this video. They got 1,000 beds in there, and this is before coronavirus also. I saw one person walk up to the desk. The guy said he wasn't feeling good, how long until they could see him. And then like a few seconds later, the guy just collapsed. And then about 5 minutes later, some doctors, nurses, or somebody came out of the back, and they, had to drag this guy back into the back. So it looks like if you pass out, you got symptoms, and you pass out in front of the front area, they will, move you up in this triage list. CMS.gov, Department of Health and Human Services, Centers for Medicare and Medicaid Services, RIN 0938 AM34, Medicare Program clarifying policies related to the responsibilities of Medicare participating hospitals and treating individuals with emergency medical conditions. All right, and so this there's some interesting discussion in here. It says several commenters believe that triage of the individual presenting to the dedicated emergency department should be adequate for purposes of fulfilling EMTALA screening obligations. Specifically, one commenter did not believe that EMTALA should apply to individuals who present to the dedicated emergency department with no significant distress or risk, as determined by triage of vital signs, and who are comfortable and active in a waiting area whereby they are well provided for while they are waiting for care or treatment. There seems to be some debate about this. All right, and then I found this. Section 1867A of the Act requires that individuals coming to the emergency department be provided a medical screening examination. The statute states, in the case of a hospital that has a hospital emergency department, if any individual, whether or not eligible for benefits under this title, comes to the emergency department and a request is made on the individual's behalf for examination or treatment for a medical condition, the hospital must provide for an appropriate medical screening examination within the capability of the hospital's emergency department, including ancillary services routinely available to the emergency department, to determine whether or not an emergency medical condition within the meaning of subsection E1 exists. Triaging is not equivalent to a medical screening examination. Triaging merely determines the order in which patients will be seen, not the presence or absence of an emergency medical condition. If the medical screening examination is appropriate and does not reveal an emergency medical condition, the hospital has no further obligation under 489.24.